5 moments. 5 moments done wrong. MRSA, MRSA, MRSA. I really like that song. Yes, I have bad news for you. There are actually 5 moments in your care for patients where hand hygiene is appropriate and expected. All of us are pretty good at remembering to use our ethanol-based cleaner when we come and go from a patient room, but few providers can recall the other 3 moments where hand hygiene saves lives. I think some of us may do these regularly and consider them common sense, but the vast majority of providers, when queried, couldn't recall moments 2, 3, and 4. Honestly, that may be because they're hard to remember, but we have to be able to speak to these when JCO comes a-knockin', because this is the WHO standard that we have set for ourselves. So let's talk about how to do these moments right by talking about how to do them wrong. I'd like you to meet Dr. Harry Hygiene and Dr. Craig Difficult. They have 2 very different perspectives on the 5 moments of hand hygiene, but most importantly, they are not Cole Beeler. They are different people. They are not related, as you can easily see with your eyeballs. When coming into a room, Harry double pumps and washes his hands prior to entry. Craig acknowledges the dispenser, but laughs in the face of antiseptic pseudoscience and walks right into the room. Harry always washes his hands when he leaves the room to assure he doesn't spread germs to his other patients, coworkers, and family. Craig likes to leave the room in style, and pausing to pump the dispenser will only jack up his floor routine. How can he expect to stick the landing with his hands all slippery and stuff? Some things are just more important. You have to understand that. Harry washes his hands before touching the supply cart in order to prevent transmission of germs from the patient to the shared equipment. Craig has no concerns about touching the patient's environment. One world, brother. One love. Let's get together and feel all right. Harry washes his hands, gloves up, scrubs the hub before messing with the patient's IV. He does the same thing for all aseptic or clean procedures. Craig makes sure no one is looking and also scrubs the hub. He heard once that human mouths were actually cleaner than dogs' mouths, so this should be adequate. It does seem evidence-based. Ever heard of a spit shine? It's kind of like that. Harry empties the patient's Foley bag with gloves and then washes his hands before he touches anything else. He does this after he touches other potentially contaminated or nasty stuff coming out of patients. Craig empties the Foley bag barebacked, refuses to wash his hands, and proceeds to examine the patient in the most awkward way possible. So be like Harry and remember your 5 moments of hand hygiene and clean your hands when you're coming into a room, when you're leaving the room, before you touch anything outside of the patient's zone inside the room, prior to an aseptic or clean procedure, and after you touch or handle nasty fluids coming out of patient orifices. There's some other areas of hand hygiene that are important to discuss. For instance, technique is important. Harry rubs his hands on the front, back, interdigital areas, and around the thumbs. Craig does the baby squirt, the no scrub drip dry, the I'm too busy to figure out how this thing works, and the shooting blanks retreat. He likes to be creative with hand hygiene. He thinks there are multiple different ways to skin this cat, and maybe this cat doesn't even need to be skinned. I mean, what did this cat ever do to Craig in the first place? He actually really likes cats. Harry washes off his scope when he leaves the room. Craig stores his scope for safekeeping, but doesn't consider this device to be something that can transmit pathogens. He says it's called hand hygiene, not scope hygiene, stupid. Even if the patient isn't in contact precautions, Harry wears gloves and gowns when dealing with the uncontained secretions. Craig doesn't like these gowns, so he doesn't use them, even when the splatter factor is high. Once, he got stuck in a gown for like 3 months and had to call in sick. Over the interval, he lost like 20 pounds and made a mess in his bathroom. He won't let that happen again. Not today. So to wrap things up, Harry has a practice that approaches each patient like they could potentially be infectious and follows common sense standard precautions and uses horizontal measures to reduce transmission of pathogens to himself, his other patients, and his family. Craig does whatever he wants and makes up fake rules about when he does and doesn't need to use hand hygiene. But I have a confession, and this may come as a surprise to you, but both of these doctors were actually me the whole time. I'm not kidding. I am a master of disguise, and you shouldn't feel bad for being fooled by such a cunning chameleon like myself. But in all honesty, we all show variation in our hand hygiene behavior, and sometimes we're Harry, and other times we're Craig. We're human. We make mistakes. That's why it's important to tell people when you notice a lapse in their etiquette. Most of us just forget and need to be reminded. Hand hygiene is a team sport, as is preventing all hospital-acquired infections. Don't be a Craig. Thanks for watching. Email me with questions. Subscribe to the VIPER YouTube channel and follow me on Twitter.